talk about HPV and the HPV vaccine and why it's so important from a public health perspective. Since the HPV vaccine has come to market worldwide, we have seen a significant decrease in the rates of cervical cancer as well as other HPV-related disease. It's really made an impact. It's important to know a few things about the HPV vaccine. First of all, there are 9 strains that are currently covered in the most recent HPV vaccine. 9 might not seem like a lot, but listen to this. It covers 90% of the strains related to HPV that causes cancer and 90% of the strains related to HPV that causes genital warts. I think that's a really big deal. It's important to know that the HPV vaccine can be given to both boys and girls from ages 9 to 26. But most recently, that has been increased to age 45 because we've seen that it's really working well to decrease HPV-related disease. It seems to work best if we give it between ages 11 to 12, when your immune system is very robust and when theoretically you haven't had sex to experience an HPV infection. There are a few other things that you should know before getting the vaccine. 1, you don't have to test positive or negative for HPV before getting the vaccine. That doesn't matter. It's important to know that if you become pregnant during the course of getting your vaccine series, you should defer until after the pregnancy. The HPV vaccine is either 2 or 3 shots depending on how old you are when you start the series. It's important to remember that no vaccine is perfect, so you should still plan on having your routine testing starting at age 21 for sexually active women and continue to age 65 unless your doctor instructs you otherwise. It's really important to remember that you still need to use condoms regardless of your HPV status and the status of your vaccine. Talk to your gynecologist or pediatrician if you have any questions regarding your HPV vaccine. And also remember, it's covered by most insurances.